Good afternoon, and thank you for joining us for our weekly series of Alabama Works live webinars dealing with Alabama's workforce response during the COVID-19 pandemic. Past episodes are available on our website at AlabamaWorks.com. And now, Tim McCartney, Chairman of the Alabama Workforce Council.
Good afternoon. Glad y'all are joining us today. We have two special guests today that will enlighten us on where we are as far as the state is concerned on reopening and when, and they're going to give us their points of view on that subject. I hope today you're all doing well and practicing the social distancing and the health procedures that we're all aware that we should be practicing. I'm pleased to welcome Lieutenant Governor Will Ainsworth to this week's webinar. Mr. Ainsworth was elected as Lieutenant Governor in 2018 after serving one term in the State House of Representatives. In his role as the Lieutenant Governor, he also leads the Alabama Small Business Commission, which recently submitted its recommendations regarding responsibly reopening Alabama's economy to Governor Ivey. Under Mr. Ainsworth's leadership, the Alabama Small Business Commission meets quarterly to formulate policies, encourage innovation, discuss issues critical to the economic growth of small and independent businesses and their interest. Lieutenant Governor is from Marshall County. He's an owner of a small business. He's passionate outdoorsman, and he's an Auburn graduate. So welcome to our show this afternoon, Lieutenant Governor. The floor is yours.
Go make sure it gets unmuted. There we go. All right. Yeah, first talk about our Small Business Commission. That was Governor Ivey's idea. Traditionally, they've been under the governor's office. Right after we got elected in November, when we got elected together, she brought us in her office, said, hey, I'd like for this to go under the Lieutenant Governor's office. We got a bill passed last session. When the COVID crisis came up, started obviously being issues with small business, she asked us, as well as Congressman Bonner, to look at the small business community, get a group together. So we formed an emergency small business task force. From that, the members were Representative Danny Garrett, and we had a subcommittee that I allowed, and he ended up being chairman. Senator Chris Elliott from Fairhope, Senator Bobby Singleton, which is the minority leader, Senator Garland Gudger from Coleman, Representative Joe Lovern from Auburn, Representative Anthony Daniels, which is minority leader in the House, Representative Kelvin Lawrence, which is a small business owner. He owns Subway franchises. We had Katie Britt from BCA, Rosemary Elbash with the NFIB, Mindy Hannon, which is the Alabama Restaurant and Hospitality Association President, Rick Brown, Tony Cochran, which is a CPA, and then we also had Stephen McNair Preservation from down in Mobile. And we were tasked with looking at, as a narrow focus, and we were tasked with looking at small businesses, basically any that had deemed potentially non-essential, and how we could look at potentially getting them back open. And so, we looked at first and kind of just walk y'all through briefly to go over that. We wanted, the governor wanted us to give her recommendations so she could analyze these along with other reports she was getting from congressman, as well as her 7-member committee of the task force. From that, she'd make her recommendations to the state. So we were focused with small business. First, we looked at retail, and we had different criteria. And so, our first criteria was businesses we thought could open now. So that means whenever or immediately is I think the term we use. So whenever she makes her recommendations, we thought they could be opened, at that time. First is retail, and we looked at just different small stores compared to box stores, and just kind of compared risk, and basically just came up with guidelines on small stores similar to the larger box stores, which were similar space guidelines, making sure you practice social distancing, making sure you had tape in the checkout lines, and our opinion was they could be open in a safe manner. We also looked at jewelry stores, which is a subcategory under that, and felt they could be in line as well. Now there was different for instance, in jewelry stores, we had recommendations where sometimes people have to wear gloves, use hand sanitizers, but on all these we had restrictions. Also had medical community weigh in on some of these. Fortunate to have some people from UAB as well as the Medical Association look at some of these issues. Next topic we looked at that we thought could open whenever she made recommendations were restaurants. Now, it was pretty stringent on this. And obviously, if you had a smaller restaurant or the layout, this might not work. But for most restaurants, and we talked to a lot of restaurant owners, as well as Mindy was a huge asset here. Obviously, Representative Lawrence serving on there was helpful with him being a restaurant owner in Subway. We looked at, on the restaurant side, just going in and saying, okay, first thing you need to be, you could have 6 in a group, right? So it'd be capacity at 6 per table. And then the tables had to be 6 foot apart from anyone else. And so that was that. As far as waiting areas, when you came into a restaurant, just one person from your party would be allowed to go in, check in, and then you'd wait in your car until it's your time to go in the restaurant. That, again, these recommendations came from the restaurant industry, which was our, what we were tasked to do, is take industry recommendations on how they thought they could safely reopen, with the idea that industry understands best how they can or cannot operate. And I don't think it's fair to task Dr. Harris with knowing every industry in the state, the ins and outs. And so hopefully this will be a document that helps him. The next kind of segment of industries is close contact services. And this has several. It's barbershops, hair salons, nail salons, and tanning salons. And, we made the recommendation. We thought that these could open, whenever the governor makes her decision, immediately as well. Thought process on this was, if you chose not, and that's on any of these, right? You don't have to do it. And so if you don't want to go get a haircut, don't do it. If you're elderly or at risk, certainly don't go do it. But on this, we had more stringent requirements than even retail or restaurants, because people are actually touching you. So we had masks that were on, in all of these categories. And there were gloves that were on there as well. And in each different category, it went through and listed what they do. Additionally, in the barbershops and your salons, it had to be 6 foot apart, each chair, to make sure you practice social distance. And we had recommendations on the larger barbershops on the capacity. No one could be in a waiting room. The final thing on what we thought could open immediately, this one's a little bit tougher and had a lot of challenges, would be childcare services. But the thing I think on, when you look at even essential workers and also people going back to work, is there's got a lot of times childcare is something that's really important. It's something that needs to be addressed. Now, that's challenging because you've got a lot of kids. Obviously, you kind of get kids around each other. Germs are a huge, problem. We went by the CDC guidelines on the childcare services and the recommendations there. All right, so the next topics that we have were May 1st openings. And the first, we worked with the Medical Association, worked with the Dental Association, Physical Therapy, Optometry Association, and looked at when could these industries open, and different guidelines, but our recommendation would be May 1st on them. And some of them, obviously limiting factors for them open would be having access to PPE, making sure that they could get that. That's a big issue, and could potentially push back that date. But most of them, I know doctors I talked to in my community, I was involved in this, some, they're ready to open now. I know a dermatologist, he's ready and has the equipment, PPE necessary to go back into doing, just normal dermatology stuff, and feels that he's got enough for him and his staff. Some of the general practitioners in the community feel the same way. But we also had advice from the Medical Association and took that, and they were very helpful. But Medical Association, dentists, physical therapy, and optometry have recommendations for all that based on their specific segment where they can get back. Because I know I talked to several of my dentist friends, and we had to actually do a revision on that, on some things we made a few mistakes on. But they're needing to open back up, right? And when you look at the health from obviously filling cavities, making sure people get proper cleanings, those are certainly things that a healthy community is going to need. And so we're in support of that, but we got to make sure we do it in a safe way. And in all those issues, the waiting room was a big area, and we had criteria and restrictions there on how many could be in there, or practice social distance. And sometimes you'd have to wait in a car depending on which segment you were looking at. The next thing that was a May 1st guideline was entertainment venues, and that was broad, but the ones we thought could open May 1st were gaming facilities. So that's your bingo halls, that would be your casinos, things such as that. And but they had strict guidelines in there. It was 35% capacity. They would actually shut off, for instance, if they had bingo machines, they would shut off some of the machines to make sure there's social distance in between them, as well as have cleansing guidelines on these machines. And we felt good about the recommendations that industry brought forward and we worked on. Senator Singleton was a big help there, and we appreciate that. Exercise facilities, there's a lot of those across the state. They're already doing a really good job of sanitation, but we felt, the social distancing was something that needed to be implemented. We worked with exercise facilities on getting that up to date, and I think there's a plan to do that. The issue is obviously with trainers, that kind of limits what you can do as far as classes. There's some limitations there, just because of social distancing and having groups smaller. But as far as just going in, exercise and having machines spread out, we think there's a way to do that and potentially do that in a safe way. Museums, planetariums, those were other topics we looked at and worked with ways to open them in a safe way, and think that's important. I talked with the Space and Rocket Center just yesterday. They're very concerned about most of the revenue comes from space camps, but they do have a museum. Potentially, if that's able to open, that gives them a revenue stream that could be good for their business model. There's museums all over the state that we had input from on this. So that was a May 1st. All recommendations there. Next would be beaches, and this was when we got a lot of input from the Baldwin County community. Looked at talked to the mayor in Baldwin County as well as Gulf Shores. Mayor Kraft, Mayor Keenan were great. Also talked to the sheriff's office there, and Senator Elliott was a big help in lining all these people up and kind of getting a consensus agreement. And what they looked at is they looked at a model they were using in Hawaii, and Mayor Kraft's daughter lives in Hawaii. And what happens in Hawaii, you're allowed to go on the beach. You still practice social distancing potentially for exercise. You can fish on the beach, you can swim in the ocean, but you're not allowed to congregate, have chairs, have large groups or any type group actually. And so the recommendation would be from May 1st till May 15th that you're allowed to go on the beach just for exercise or recreational activities is the way it's phrased. Then on May 15th on, you'd be allowed to go on the beach, but you would have to only be able to congregate with the group you're staying with, or if you obviously aren't staying at the beach, maybe if you travel down just for the day, with the group you live with in your home, I think was the language we put in there. And the idea behind that is, okay, the people you're staying with, you're obviously not practicing social distance. And if you're staying with them in a condo or house, so it's fine for you to be around them at the beach. But we wanted a 6 foot, still practicing social distance and barrier around them. And again, these are the guidelines that came from the locals that know this best. One of the things we thought was important was the enforcement side of this, because I think obviously any rule you put in place, you got to have enforcement. They stepped up to the plate, both mayors as well as the sheriff, and have a plan in place with their law enforcement lifeguards using the sheriffs to actually make sure that they are patrolling the beaches and enforcing these restrictions and guidelines that we've got in place on the beach. And then the final thing would be, we kind of looked at was, there's a lot, and I'll go over this in a minute, issues we didn't look at, but we looked at different youth athletic activities and had some others that got submitted later. We're still trying to review those, but we looked potentially, is it possible to do, basketball? Is it possible to do soccer? Is it possible to do baseball? And, the group, Joe Lovin worked on this a lot with some of the doctors at Auburn that are involved in their sports program, worked with some national leagues, worked with some state leagues, and they came up with a plan and ideas. You've got 200 feet down both sides of a field. You can spread 30, 35 people out each side, plus the outfield, that's the fans, practicing social distance. And you could potentially use the same model you use at the beach, where you've got, families are allowed to sit together, but no one else. But the idea is, it's pretty strict. It doesn't allow any concessions, that we don't have people in line. When the team gets finished playing, you have to go to the car. When they're in the field, they're not wearing a mask. When they're in the dugout, the kids have to wear a mask. So those were the guidelines that they put in place with Little League, USSSA, BPA, and that was on May 11th. And that guideline came from National Little League of 8 weeks of baseball being shut down. And so, and one thing that came into play that would have, if we'd have had this earlier, we probably would have maybe, could have tweaked the guidelines a little bit, was President Trump's recommendations Thursday night. Most of our recommendations fell in his phase 1, phase 2, phase 3. We also made and he's got great recommendations, obviously, and great people advising him. You look at the pharmacies, real estate, commercial, real estate, manufacturing, agriculture. We also made recommendations there, even though they're not necessarily shut down, but those industries wanted some recommendation and guidance. And so we gave that as well. Some of the things that we didn't address, you look at larger events such as concert venues, business. I'm involved in a trade show that I seriously doubt is going to happen this summer just because we run 20, 30,000 people through an expo in July. I don't see that happening. You look at, things like the Hangout Fest, you look at movie theaters, those are things that, potentially down the road. I think look at the president's guidelines, those are like phase 3, and we're obviously a ways from those. But so this, the governor's team's doing a great job. She's been great to work with. Look forward to seeing, what she recommends. And I can tell you this, people of Alabama are eager to get back to work. These people have been impacted or, they're ready. And I think what we've got to do is make sure that when they go back to work, they go back to work safely. But I think the good things, people in Alabama are aware, and hopefully these guidelines will help, reduce the risk of any disease being spread and give good guidance to businesses. So that concludes my report. Be glad to take any questions.
Thank you so much for that, and some great insight. And I appreciate all the hard work that y'all put into that. I know it took a lot of time, a lot of research, so we appreciate you sharing that with us. Chris, would you like to ask the Lieutenant Governor the questions we have, please?
Yes, sir. Lieutenant Governor Ainsworth, your Small Business Emergency Task Force recommendations released last week note that Alabama businesses should begin to reopen in May. Is your recommendation to reopen based on a time certain date? And if not, what criteria do you recommend that the state use to determine when businesses should reopen?
Yeah, so on ours, we had recommendations that said, when I was walking through, first businesses that could open now. And so those are businesses that we felt, pose little or potentially even less risk. Obviously some pose some risk, but, and they could go ahead and open now, right? That maybe weren't deemed essential. And that was retail, restaurants, but with reduced capacity, and then close contact services. We recommended May 1st, and that was working with the medical community on those guidelines, the entertainment venues, and then the beaches. And but obviously, and I think it ties in well, because if you look from what I've counted, I think we're on day 11. If we continue to go down to day 12 of declining numbers, with the peak being, I think it was like 369 cases or something like that. I'm not looking at the numbers now. And since then, they've been sliding down, and that's cases in the state. So if that's the case, then 14 days according to the president's guidelines would be Thursday. But again, we're just making recommendations to the governor, and that's her job on when she wants to reopen. But we gave recommendations before the president's guidelines came out, and we had dates in ours, so we kept them in there. Just kind of based on what the industry thought. Sometimes it was the industry needed to get prepared. And so, for instance, some of these restaurants, even though we say they can open now, they're not going to be able to because they haven't been serving food. They're totally shut down. Some are already serving food, and they'll be able to reopen immediately. Obviously, got to get their staff back in. But so that's the answer to that question.
All right. The next question is, what is the Small Business Emergency Task Force plan to instill confidence in the general public that going back to work is safe?
Yeah, absolutely. I think that's a great question, because there's a lot of fear, and rightfully so. I think when you look at, the virus, it is deadly. It is contagious. We know that. And I think, what we want to do is make sure, instead of just saying open things up, right, we thoughtfully talk to these businesses, and we had 3 criteria in mind. First, what can we do to make sure the customer is protected when they walk in the store? Second, what can we do to make sure the employees are protected when they walk in the store? And third, what can we do to make sure that COVID, just doesn't spread, period. And so all of that criteria was given when we, made the recommendations here. And so what we've got to do is just let the public know that, thoughts went into this, that, and by the time all this is vetted through the governor's process, it's going to be a good report. She's going to have good recommendations that are going to be based on science and also business recommendations, and the public should feel secure that as long as they do what, Dr. Harris recommends, as long as they practice good sanitation, that there's a way to safely work and minimize the risk of contracting the disease.
All right, the third and final question we have for you is, the CDC recommends that we should wait 14 days after a declining trajectory of COVID-19 cases before reopening businesses. Since Georgia and South Carolina plan on reopening businesses on Monday, do you recommend that we follow the lead of those states, or should we wait the full 14 days before reopening? Or do you propose to reopen regardless of what other states do?
Yeah, so before the president's guidelines, we had our guidelines to open. I'm fine with, doing the 14 days, which according to our calculations, assuming everything goes right, would be Thursday. And that would be from the peak. And again, I'm not exactly sure if that's got to be 14 consecutive days of declining, but in my mind, the way we test and different test results coming in different ways, we've had, I think it's 11 days of declining numbers. And so I would hope that, I would say that at least it's the options there for us to open this Thursday based on the president's guidelines. Sorry, I went dark there. Okay.
All right. Well, I think that completes the questions. Ms. Nagle, we really appreciate you taking the time out of your busy schedule to be with us today. I know you're busy. We appreciate your commitment to the state. And I know you and your committee are doing the best you can to get us some recommendations to get back to work as soon as possible and keeping the people of Alabama as safe as possible. So thank you again for joining us. And I know you have some prior commitments and are going to need to leave. So thank you again, and call on us if we can help you in any way. Okay, our next guest today is Mr. Joe Bonner, who is currently serving as the Chief of Staff to Governor Kay Ivey. Joe was named to his current position in January of 2019 after serving a few months as Senior Advisor to the Governor. Prior to that, he served as Interim Executive Director of Tuscaloosa County Industrial Development Authority, the Vice Chancellor of Government Relations and Economic Development for the University of Alabama. And of course, he served 10 years as, that's 5 terms as Congressman from Alabama's 1st District in South Alabama. Mr. Bonner is highly regarded as a strategic leader with the ability to build teams, and is experienced at working with local, state, national, and international leaders to position Alabama to successfully compete for new business and industry. Mr. Bonner, we certainly welcome you to the program today.
Kim, it's great to be with you and all your members out there. Thank y'all for letting us be a part of your conversation today. I'd like to just take a minute to follow up on what Lieutenant Governor Ainsworth brought to the table, because as you mentioned, his Small Business Commission did take the responsibility that the governor gave him when he became Lieutenant Governor very seriously. And in recent weeks, we've worked very closely with Lieutenant Governor, Attorney General, and so many other constitutional officers, legislative leaders, people throughout government in both public and private sector to try to deal with this COVID-19 pandemic. One of the things that Lieutenant Governor talked about was the report. This is a copy of it right here, and it probably doesn't show as well on the screen, but it is very comprehensive. It's very thorough, and it's got a lot of really good input into it. And so we're grateful to get it. We've also been getting a lot of other good suggestions. We've gotten something from the Alabama Technology Network. The governor has asked for all 7 members of our federal congressional delegation to provide reports. And we've gotten some today from Congressman Adderholt and Congressman Brooks and Congressman Byrne and others. We expect to get reports from all 7. We've heard from different mayors, Mayor Battle, Mayor in Huntsville, Mayor Simpson in Mobile, Mayor Maddox in Tuscaloosa. We've heard from a number of legislators, legislative leaders like Speaker McCutcheon and Senator Marsh, Senator Orr, Representative Terry Collins, So we've gotten a lot of really good input, and the governor has expressed her gratitude to each and everybody, whether you're in an elected office or you're a private citizen and you want to make sure that your views are known. We're getting a lot of good recommendations, and we do appreciate that very much. Kind of piggybacking off of what the Lieutenant Governor said with the Small Business Commission report, we are now charged with taking all of these good ideas and suggestions and trying to put it together, kind of like a big jigsaw puzzle. And so the governor, long before we had our first reported case of COVID-19 in Alabama, actually created a coronavirus task force. And they started meeting and talking virtually, of course, on conference calls about what we needed to do to prepare as a state for this. And I will tell you, Tim, it won't surprise you because you certainly know the governor and have worked with her closely, but Kay Ivey wants us to be prepared. And so be prepared we've been. The governor was the first governor in the Southeast to close the beaches in Alabama. Other southern states followed suit. We didn't issue a stay-at-home order as early as Louisiana did, but we were one of the first states in the Southeast to put the stay-at-home shelter in place, recommendations in place. And the Lieutenant Governor talked about some of the things that we're now going to try to unwind and try to open back up again, like restaurants and small businesses. But those decisions were made in direct partnership with Dr. Scott Harris, our state health officer, and other medical experts as well. Because if you recall, 6 weeks ago, the models, the forecasters, the predictors were saying that Alabama could be in for one heck of a rough ride. We've already lost way too many people, innocent people whose lives have been lost. And so every life that was lost is a life that we mourn. But it's also important to realize that the decisions that the governor has taken, and most recently the stay-at-home order that was put in place 2 weeks ago, was based on the data. The data showed that we needed to have a more serious response than what we were getting by being nice and asking people to stay at home. So the order was put in place between Dr. Harris and the governor. And that order, the intent of it, I think, is bearing fruit today. I think the reason we're having these conversations about how we're going to reopen the state is a direct result of the stay-at-home order that the governor put in place, which actually runs until April 30th. The Lieutenant Governor's recommendation and all of these others that we've received many of them have very similar traits to them. We've maintained since the very beginning that there were some businesses that we had, food processing businesses. Restaurants were allowed to stay open, just you couldn't have in-dining service. We were trying to meld public health and public safety with also not having such a drastic impact on our economy, even though our economy nationally and globally has been dealt a really tough hand. Governor Ivey said early on that business is very vulnerable even in good times, and that government has a tendency to be overhanded at times with regulation, with taxes, with bureaucracy. So I've heard her say several times that government can kill a business, but it's hard for government to bring a business back to life. So what we've tried to do is to put some of these businesses in, I would call like an economic coma, self-induced economic coma that hopefully gradually we can now start pulling back out of and start reopening the economy sooner rather than later. And that's what these recommendations from all of these individuals, and we'll continue to get them. I would like to tell you just briefly the process that the governor and Dr. Harris intend to use to take all of these ideas and suggestions and try to put them all together is very simple. So I mentioned that even before we had our first reported case, she created a statewide task force called the Coronavirus Task Force. They meet at least weekly on a conference call, usually on Mondays. It's after the governor has participated in a conference call with Vice President Pence, President Trump, and healthcare experts, as well as the nation's governors all around the nation. They meet every Monday morning. And as soon as that's over, about an hour later, we have our state coronavirus task force. Recently, Governor Ivey created an executive committee of that group of about 30, 35 people. The executive committee has got 7 people on it. It's led by Kelly Butler, our finance director for the state of Alabama, and Greg Canfield. He'll shoot me if he hears that I forgot his name, Secretary Canfield. I just got off the phone with him, our Secretary of Commerce. It's also got Speaker Mac McCutcheon, Senator Del Marsh, Dr. Nancy Johns, noted doctor who was the interim Dean of Medicine at one time at UAB and then became the Dean of Medicine at the University of Virginia. Mr. Tim Vines, the president of Blue Cross Blue Shield, Alabama's largest insurer, as well as Dr. Selwyn Vickers, the Dean of Medicine and Senior Vice President at the University of Alabama at Birmingham. Those 7 individuals are taking all of these suggestions, all of these ideas, and trying to put together a master plan, if you will. And they've been working on it really for over a week now. They just finished a meeting in Birmingham just a few minutes ago, and I got a really good report from Secretary Canfield, who called to tell me that this meeting they had today was very productive. We will be getting the recommendations from the 7 congressional districts tomorrow, and then going forward over the next few days and into the weekend, they will be putting together recommendations so that Governor Ivey and Dr. Harris both can get the best of all these really good ideas, how they will work, when they will work, the timing of them. And then our goal is to try to announce that early next week so that whether it's in a phased-in approach, as Lieutenant Governor Ainsworth recommended in the Small Business Commission report, or some other model that's out there, we want to give people as much notice as possible. I actually was on a call very similar to this earlier today with the West Alabama Chamber of Commerce. And one of the questions from that call was, you're a small business, you're about to reopen again, but where do you get your PPE? Where do you get your protective gear, your mask or your gloves or whatever that you might need to reopen? And that's a very good question, because our healthcare providers are having a hard enough time getting that in our hospitals and our nursing homes, in our veterans homes as well. So that's the kind of thing that even if we could just flip a switch, as the governor says, it's not as simple as flipping a switch, but even if you could, you still have to be able to be prepared for when we are reopened, so that hopefully customers are in a position to come back and help re-energize Alabama's economy, which ironically, just a few weeks ago, we had the lowest unemployment, as you know, 2.7% in the history of Alabama. It's 3.5% last month. It will go up even much more in April, we're sure of that. But we're working as a whole of government, Secretary Fitzgerald Washington, the Department of Labor, Secretary Canfield at Commerce, the Revenue Commissioner, Vernon Barnett. We're doing everything we can as part of Governor Ivey's administration to make sure that state government is working for the people and not against the people. So thank you for letting me give you kind of a tackle on to what the Lieutenant Governor said, because it does really dovetail nicely with the recommendations we're getting. Now it's time to put all those recommendations on the table and see which ones we can make fit and at what time.
Well, thank you very much for that, those comments, and I think people will certainly appreciate that. We do have a few questions for you as well, if you don't mind answering.
Absolutely.
Chris?
Chief Connor, how many tests does the state of Alabama currently have, and is that amount enough to adequately monitor the virus in our state?
It's a great question. We don't have enough, no, but no state does. Alabama's tested about 1%, slightly less than 1% of the people of our state. And nationally, we've tested about the same number. Governor Ivey was on a call this past Saturday afternoon. I was able to join her with 5 other Southern governors, a couple of whom have already announced that they're going to open up this week. And that was the general concern, was as the White House gave us guidance last Thursday about things that they think we need to look toward in terms of steps that we need to be prepared for to reopen the economy. One is making sure we've got adequate testing. So it's clear we won't be able to test every person in Alabama between now and the end of the month. That's not feasible, but we are securing tests. Every day we're getting new testing sources. And quite frankly, we've been very grateful for the corporate partnerships we've had. Walmart recently just stood up 2 testing centers, one in Jefferson County and another one in Montgomery County. And actually, they're going to move some of these testing sites to the Black Belt, to the rural areas. I think it's going to, well, I better not announce where they're going to be yet until Walmart tells us. But I promise you, we're going to try to go to all 67 counties. All 67 counties have been tested, but I would be disingenuous if I led you to believe that we are adequately testing at the level we need to. But we're working aggressively with Dr. Harris and with private and public entities to make sure we get those numbers up.
You mentioned earlier about the limited supply of personal protective equipment. If a business or a school experiences difficulty obtaining adequate supplies of PPE, who should they contact?
Well, another great question. One of the governors on the call on Saturday said, we're leaving it up to the schools, we're leaving it up to the hospitals, we're leaving it up to the medical practices, we're even leaving it up to the small businesses. We can't source PPE from the state government. Alabama's taken a slightly different approach. We don't want to assume the responsibilities for everybody, but early on, it was obvious that there were not enough supplies, not only in Alabama, but around the country and quite frankly, around the globe. So the governor set up in the very early days 2 different groups to start helping us source our own supplies. One was our strategic asset team. We had several volunteers led by a young man, Brian Rel. Brian and I had served together up in Washington. He was Congressman Adderholt's chief of staff, recently moved back to Alabama, and just called up one day and said, how can I help? So having someone who had almost 20 years of Hill experience who was offering to help gave us a unique perspective and a great talent. So Brian set up our strategic asset team. And with people from Huntsville and Mobile and Montgomery and Tuscaloosa, all points in between, we started going out trying to find those supplies. Now, this was in the early days when we were being told that our hospitals were going to be overrun, there wouldn't be enough beds, there wouldn't be enough ventilators, there would not be enough gowns. Strategic Asset Team has made a lot of progress in that area. And now the Unified Command that includes the Public Health Office, the State Emergency Management Agency, as well as the National Guard. They're working on a daily basis. They've kind of taken that responsibility back over. But we expect, we've already gotten several shipments of PPE. Tim Cook with Apple, Robert Sale, Alabama native, Auburn graduate Tim Cook, called the governor up one day and he said, Governor, I might not live in Alabama, but my home is in Alabama. What can we do to help? So we've gotten so many great donations from people like Mr. Cook, from Walmart and others. Hyundai Motor has donated some masks. They're in the process of getting some testing kits. Same thing with Mercedes. It's been very heartwarming. I'm leaving a lot of good companies out, which is a dangerous thing to do when you start down that list. But we've just been overwhelmed by the gratitude and the generosity of so many companies that have said, we want to help get supplies. But I think to answer the question more directly, we're all going to need to be responsible for sourcing, especially if you're in business or manufacturing. You need to make sure that you're going to have your supplies before you can rev your engines back up and be fully operational again.
That's all the questions we've got, Tim.
Oh, okay. Thank you, Chris. And Mr. Bonners, thank you so much for taking time out of your busy day to join us. I feel really good having a person of your stature in the chief of staff's office advising the governor, particularly with your Washington experience and contacts. That makes me sleep better at night. I know it certainly makes the governor feel better. So thank you for joining us today. And I know you've got a busy schedule as well, so we don't want to keep you any longer than you have to. Our last speaker today will be our regular, I guess. Nick and I are the regulars each week. Nick Moore from the Governor's Office of Education and Workforce Transformation. Nick's going to bring us up to date on the Alabama Workforce Response Survey that was sent out a few weeks back. And then we've asked a couple of times on the webinars for people to participate. And I want to thank all of you that did participate, because we were looking for a sample population of somewhere north of 1,000 respondents. And I believe Nick told me we had a good many more than 1,000, and that's due to y'all listening to our request, and I appreciate that. So Nick, take the floor.
Thank you, Mr. Chairman. So we did have an exponential increase in the number of respondents on the survey. So last week we had 549. Now we're at 1,728. So over a threefold increase. The five largest counties by response, and we'll send this out to the full group here so everybody can take a look and see which counties have responded. But Etowah County, I think that's because we've got Chairman McCartney hailing from Etowah County, got all his folks to show up. So that was wonderful. Jefferson County, followed by Baldwin, Lee, and Madison County, rounded out the top five. We had a lot of small employers that responded, which we know small businesses are the greatest number of businesses out there, so that makes sense. 69%, or 1,180, were small businesses with under 25 employees. 42% had less than, or excuse me, 42% had 76 to 100% hourly workers. So most of these that responded, most of their employees were hourly employees. Only 10.5% had a contingent workforce of greater than 25%. So most of these employers had full-time employees as well. So the largest industry clusters to respond were health services, retail, accommodations, and food service and manufacturing. And 50% said that their business climate was bad, but 50% also said that they believe that their business climate would improve within the next 6 months. So a lot of people are feeling that we will bounce back from this and it will be a temporary situation. 50% also think that their workforce is going to remain constant over the next 3 months. 36% said that the biggest factor that was impacting their business climate was a lack of demand. So that seems pretty clear when we're looking at, obviously everybody is hunkered down, and the number of consumer durable goods and just your average consumer goods are not as in high demand right now. There could be a lot of pent up demand behind that though, which could be good news. 46%, so just a little bit less than half, felt like they were equipped to handle COVID-19, which I thought was actually a pretty good thing. Also, 46% said that they were facing a supply disruption during COVID-19 of some kind. And 82% said that they believe, which I was surprised that it wasn't 100%, but 82% believe that COVID-19 is going to have a financial impact on their business negatively. 32% have laid off employees. And what's interesting is that those that said that the business climate was bad was they were 3 times more likely to lay off individuals. 54% are planning a hiring freeze, and 49% say more employer-driven training will be needed during and after the COVID-19 pandemic. So that's the highlights of the survey. Thanks again for everybody participating. This data set is going to allow us to inform the delivery of not only state but federal resources, and look forward to, we're not going to wear you out with surveys, but in the next several months we may have 1 or 2 more that will also seek to inform future decisions about where to allocate scarce dollars, make sure they're getting in the right hands. So Mr. Chairman, thank you, sir.
Thank you, Nick. Thanks for that update. And again, I appreciate all of you that responded, because that does, a larger sample population gives us better data and helps our state leaders make more informed decisions on how and when we come back to work. Before I close, I just wanted to thank our AIDT staff that's that's managing the technology behind this Zoom video, and Chris does a great job, and he's got several cohorts, Sonia, Jill, from AIDT working together to make this work every week. Appreciate all the hard work they're doing. Also, our AWC members, we've got a lot of members out there doing a lot of work as we do this, as we're going through this COVID crisis. We have many of our members that are essential to our economy, and they're continuing to work, and they're having to work under this environment. So given that, next week we're going to put on a webinar that, given the fact that we're soon to go back to work, we're still, as you can tell today from Mr. Bonner and the Lieutenant Governor, we haven't got the exact date of when we go back, but we need to know how we need to go back, and we're going to try to make a little sense of all the different regulations coming from the feds and the CDC and all that. So we're going to have some attorneys from Balch and Bingham who have been doing lots of research and work with their clients on this. They're going to update us on the ins and outs of what we need to be aware of. And then we're going to have a case study from one of our members who has worked through the whole crisis. They've been working throughout the whole situation, and they've actually encountered some positive virus employees and what they did. So I think it's going to be helpful for those of you that are still not back engaged in the economy. And hopefully we'll be able to bring you some news that will help you. Again, this is a very fluid situation. Things change from day to day, and that's important for us to bring you up to date with the most up-to-date information we can. And then finally, next week, today we learned that Secretary of State John Merrill is going to come on at the end, and he's going to give us an update on the election process for the runoff election for this summer. So look forward to being with you next week. And until then, stay safe and be careful.